We are gathered here today to mourn the loss of the celebrated and ever-revered lecture. Yes, the lecture, as educators have known and loved, is no longer with us, boring us to death due to perpetual overuse. You may ask yourself, how can this be? What will I do? How will I teach? We have all experienced the lecture as the method of choice for disseminating vast amounts of information. So with this loss, where do we go from here? The lecture and other teacher-centered methods have been utilized in nursing education for a long time. The instructor, seen as the expert, is forefront in the process, transferring his or her wealth of information to the students, as the students passively accept this transference of expert knowledge. As Candela, Daly, and Benzo Lindley assert, teacher-centered methods often rely on repetition, memorization, and recitation to transfer knowledge from teacher to student. As well, teachers equate talking with lecturing and tend to think that their way of understanding is the best or the only way. So why do you teach the way you do? What has influenced your teaching philosophy or perspective? Starting with a self-assessment is a great starting point. Using a mind map or creating a Wordle are effective techniques for brainstorming what you believe are characteristics of good teaching or teachers. Reflecting on my own teaching, I began as a special care nursery instructor, due mainly, I think, to my strong clinical expertise and my love of working with neonates and their families. I did not know how to teach per se, nor did I have a specific teaching philosophy or perspective. However, as I look back, many nurses were brought into teaching positions in a similar fashion. There seemed to be an assumption that clinical expertise would automatically translate into teaching expertise. Little attention was paid to teaching perspectives or how to actually teach nurses. Basically, we taught the way we were taught. Other perspectives can be utilized to decrease the passive, teacher-centered learning approach. Nursing literature is now suggesting a shift towards a learner-centered approach to teaching nursing students. Murrow, Russell, Hardick, and Kerr suggest that learning-centered approaches are much more productive, but unfortunately are underutilized. Student-centered approaches shift the teacher's role from one of expert to one of facilitator. Students are actively engaged in their learning, participating in learning activities that stimulate thinking, promote dialogue among their peers and facilitator, and continuously build on knowledge as they learn. Learner-centered approaches shift the focus from one of teaching to one of learning. Both instructor and students are co-learners in a cooperative effort to build knowledge. Thus, the environment becomes one of mutual respect, cooperation, as well as collaboration. With a shift to the role of facilitator, the teacher must learn to also then share power. The power differential inherent in teacher-centered approaches, with the teacher having more power, becomes one of shared power in the learner or student-centered approach. With shared power between learner and facilitator comes the expectation of shared responsibility for learning. Students are expected to come prepared to class, ready to actively engage with others. For students who have been entrenched in teacher-centered methods, this can pose a challenge when they experience a learner-centered classroom. For example, problem-based learning, a learning-centered approach, utilizes a problem derived from clinical experience to provide the context for group work among students. As they discuss and analyze a clinical problem, they learn reasoning skills, acquire knowledge, and integrate nursing concepts. Building upon previous experiences, learners acquire new knowledge through active learning within learner-centered perspectives. Learning through group work and activities, reflective practice, learning within contexts, and preparation for and awareness of ongoing learning prepare nursing students for the demands of complex nursing environments. Of course, this requires educators to become adept at facilitation skills. Wolf outlines various facilitator roles that are crucial for effective learning. Facilitators can model problem solving through asking students critical questions to guide their thinking. So, do learner-centered approaches really mean the death of the lecture? Well, not exactly. Ohrmann suggests integrating active learning with lecture, as opposed to active learning being in opposition with lecture. For example, short lectures interspersed with active learning activities can integrate both perspectives. As educators, we can utilize knowledge of various teaching perspectives, such as learner-centered approaches, to emancipate ourselves from the limitations of lecture. Awareness of alternative perspectives is a new beginning as we move forward to engage with students more effectively. So it's not really the death of the lecture, but rather a rebirth, a renewal, a chance for a new beginning in exploring more effective ways to teach and learn. A chance to move from memorizing and reciting facts to discovering and acquiring knowledge. I hope you have enjoyed this PechaKucha presentation.